Do you have a dog, or are you treating a dog that has a cruciate injury or knee injury? If you have a laser, I'm going to give you some amazing information that can help you treat that dog or even help prevent a cruciate injury. I'm Dr. Lori McCauley from Optimum Pet Vitality, and in this episode of Learn and Go with Dr. Lori, we're going to be talking about how to use our laser to treat the cruciate ligament directly. All right, let's start with some anatomy. The first thing I want you to do is look at what a regular normal knee looks like. So here's our femur coming down. Here's our tibia, the big bone, our fibula, the small bone. If we peel this back, there's our patella or kneecap, and it sits in that groove. Wow, there we go. There's the groove. So where's the cruciate? Straight in, and if you look back here, there's our cruciate. Cruciate means cross, so you can see the cross in there, the cranial and the caudal cruciate ligament. Now, let's look at our diseased or inflamed limb. Oop, this way. So now, here's our femur. Our patella would sit here. We have inflammation. We may have some wearing down of the cartilage in here. You can see our cruciate in there, and it's still right back there. So what's our magic trick? Well, to start with, we want to laser from the back. From the back is the closest way we can get, into the cruciate. So we can bend the leg just a little bit and use a little bit of pressure and laser directly in to that knee. Another way to get it is from the front. But if we look here, if I'm coming from here, if the leg is an extension, so straight, and I'm coming through here, it's a very long distance to get in there. But if I take this knee, again, upside down, there we go. Here's my femur, my patella, my tibia, my fibula, my cruciate's back here. Not really in this one because it's just bones. But if I bend the knee, now what was my tendon sitting here does this, and my distance is much shorter. So I can laser directly in there and still get to where my cruciate sits right in here. So that's two different ways that we can get to the cranial cruciate ligament visualized on the bones. So how do we do this on the live dog? Well, here's Ollie. Here's his tail, right? So here's his hip. You can see he has scar. He had femur surgery and then knee surgery. We're going to come down. Here's his knee. When we bend the knee, we have 2 points. The top point is the patella. The bottom point is the tibial crest. Between that is our patella tendon or ligament. It can be called both. On either side of that is our joint capsule, right? That's where we feel for fusion. It should be nice and concave. On the back of the leg, we have our calf muscle. So here's his hock or tarsus. The gastrocnemius muscle comes up, but it's like 2 sheaves. So there's a hole in the middle, which means that when I'm looking at the back of his leg, see how far my finger can go in? Wow, it's that far. That's how close I can get to the cruciate ligament. So in this video, I'm going to show you with a SpectraVet 810 nanometer 500 milliwatt probe, 1 diode, has great access. I can come and find that popliteal fossa, that hole, come in. Here's the size of this. Watch how far I can go in. I'm going to grab my patella tendon or the joint on either side, and I'm going to aim toward that. So now, if you can see here, I am that far in. Wow, I am right next to that cruciate ligament. And I can laser directly into it, knowing because I'm aiming toward my fingers. I know where the front of the leg is. So I can laser it that way, and I can fan up and fan down so that I'm getting that whole caudal and cranial cruciate ligament. Then I can come to the front. So again, if we bend, we have the 2 bumps, tibial crest, patella. I can feel the top of the bone here. That's where the joint starts. And the bottom of the bone there, right? Right there. That's where that patella ends. So in between here is my patella tendon or ligament. So I can laser, not into the bone, in flexion, the bottom half, aiming right toward that joint. I can feel that joint line right there. And then again up. So I'm getting 2 points on a dog his size. Smaller dog, it's only going to be 1 point. but I can go straight in and I know exactly where I'm going because I can feel my anatomy. And you know your anatomy because you just watched it on the bones. So that's how we can use our laser to get much better access to the cranial cruciate ligament.
If this kind of information gets you going, go ahead and click below and subscribe to our newsletter, and you'll get all the information we can give you every time. I'm Dr. Lori McCauley with Optimum Pet Vitality. I hope you had fun. I hope you learned something, and I'll see you next time.